Does your knee click, catch, and lock? Does doing the twist sound most unpleasant for your knee? You may have a meniscus injury. Keep watching to find out how physio can help. You may have an acute meniscal injury wait, no, not acute like this, acute like this. So you may have that meniscal injury if you heard or felt a popping sensation in your knee when playing a contact sport. What should you do if this happens? Should you have surgery, or can this be treated with physio? You don't have to have a sporting injury to do a meniscus tear. You may also have a meniscal tear if you are older and have had previous knee injuries or osteoarthritis. We call this a degenerative tear. Should this be treated with surgery? We'll keep watching to learn what type of meniscus injuries need surgery and which can be treated conservatively. Surgery versus conservative management of meniscal tears. In some cases, a large meniscal injury may do better with surgery. If you are younger, under 40, and your symptoms are serious enough to have a large impact on your activities, function, and quality of life, you may benefit from surgery. If you aren't as affected by your symptoms, or you are a tad older, you may be better off starting with conservative management. If you don't get results from conservative management, surgery can be considered later. Worst case, if you do end up having to have surgery, the more prehabbed you are, the more likely you will have a better outcome down the track. So there is no harm in beginning a course of conservative management either. Instead of surgery, or while waiting for surgery. If you do decide to have surgery, you will also need rehabilitation afterwards. Why? Keep watching to find out. But first, how do we know you have a meniscus injury? Here are some signs and symptoms we look out for. Swelling or stiffness in the knee, clicking, catching, or locking of the knee when going from sitting or from a straight to a bent knee, pain or twisting through the knee, pain going up and down the stairs, a feeling of giving way when walking, pain on the joint line of your knee. If you have any of these signs and symptoms, you may have a meniscus injury. There can be other reasons for these symptoms though, so it is important to get it assessed to determine what is wrong and what the right course of action is for you. Your physiotherapist can assess your knee by taking a thorough history and physical examination. If warranted, we will refer you for imaging. If left untreated, your knee function can potentially deteriorate, making even everyday activities painful. Keep watching to find out how our physiotherapists may treat your knee. What is the meniscus and why is it important? There are lots of structures that support the knee joint, including the bones, ligaments, and muscles. Each has their own function, including the meniscus. The meniscus is a C-shaped cartilage on the inside, medial, and outside, lateral part of the knee joint. The medial meniscus is the one that gets injured more often. One of its biggest jobs is to act as a shock absorber for your knee. The meniscus is slippery and smooth tissue, which allows the bones of the upper and lower leg to move smoothly against each other by reducing friction, thereby making bending and straightening the knee easier. The surface area of the menisci helps to spread the weight of the body to manage load-bearing forces through the knee. It can take some time for the meniscus to heal when injured, roughly about 3 to 6 months, and sometimes longer. So why does it take so long to heal? The menisci do not have a large direct blood supply. Instead, they are nourished primarily by the synovial fluid in your knee joint. This fluid lubricates and helps protect the surface of the joint in movement. This means, though, that it takes longer for the tissue to heal when there isn't a direct blood supply. So does that mean your knee no longer has the ability to absorb shock now that it is injured? No. Well, then what else would act as a shock absorber for your knee? Keep watching to find out. So then what helps the knee joint cope with injury to the meniscus? Strength, strength, and strength. Strength of the overall muscles in your legs, glutes, and hip flexors. Strength of the muscles closest to your knee, hamstrings and calf muscles. And of course, strength of the quadriceps muscles. Why? Your muscles act like shock absorbers too. The stronger these muscles are, the better your joint is able to cope with whatever activities you want to give it. It doesn't mean that you need to become an Olympic lifter, like this guy here. But you do need to have enough strength to do the things that you enjoy in life, which is different for everyone. For you, this may look like playing sport, running, walking up the Golden Bay steps, playing with kids, or gardening. Maybe for you, walking in the park, or walking dogs. So, why would exercises from a physio help? We can assess your specific strength impairments and give you exercises that are suitable for your knee condition, for where you are at right now in your life. We can work with you to progress your strengthening and rehab program to get you back to living your life, or prehab you for surgery to achieve the best possible outcome. So if you have hurt your knee, come and see a physio at Miami or Lakelands Physiotherapy for a proper assessment and planned rehab journey.